this video we will talk about the proton pump inhibitors. First we will have a histology and physiology review. The stomach is the musculo-membranous expansion of the GI tract between the esophagus and the duodenum. This is the stomach. We will have a higher magnification in its wall. The stomach wall consists of, from outside to inside, serosa, muscularis externa, which consists of 3 layers of smooth muscle, outer longitudinal and middle circular, and inner oblique, and the submucosa and the mucosa. And the mucosa consists of the muscularis mucosae, the lamina propria, and the epithelium. The mucosa contains the gastric glands, which we will talk about in more detail now. This is a gastric gland, which consists of surface epithelium, mucous neck cells, and chief cells or peptic cells, which secrete the pepsinogen. And lastly, the oxynetic or parietal cells, which secrete the hydrochloric acid and the intrinsic factor. And we are concerned in the hydrochloric acid. So now we'll have a higher magnification also. This is the lumen of the gland. This is the oxynetic or parietal cell. These are mucous neck cells. Note that in the apical wall of the parietal cell, the villus-like structures, which are responsible for secretion of the hydrochloric acid, which are called canaliculi. Note that there are many mitochondria in the basal wall of the parietal cell, which means it uses a lot of energy. Parietal cell secretion is stimulated by parasympathetic innervation and also by paracrine release of histamine via H2 receptors and also by the polypeptide gastrin from these cells. This is a schematic representation of the parietal cell canaliculus. This is the lumen of the canaliculus. This is the interstitial fluid. We have H2O and CO2 which diffuse freely across membranes. They unite together by the mediator carbonic anhydrase and they form carbonic acid, which is a weak acid dissolves into a proton and bicarbonate. Bicarbonate exchange with chloride from the interstitial fluid. So the bicarbonate goes out of the cell and the chloride goes into. The chloride then with the potassium ions inside the parietal cells are symportant. So both are excreted to the lumen of the canaliculus. The proton is pumped by the proton pump in an exchange with potassium. Now we have hydrochloric acid. We are talking about the proton pump inhibitor. The proton pump inhibitor, when goes into the parietal cell, goes to the proton pump and binds irreversibly, so inhibiting the last process of the hydrochloric acid secretion. Proton pump inhibitors, or the brazole family, because all of its members ends with the section zole. Dexlansoprazole, omeprazole, pantoprazole, lansoprazole, esomeprazole, and rabeprazole. How could we memorize them? The mnemonic Doubler. The clinical indication of PPIs are for the treatment of peptic ulcer, gastroesophageal reflux disease or GERD, as one component of therapy for Helicobacter pylori infection, Zollinger-Ellison syndrome or gastrinoma, stress ulcer treatment and prophylaxis, and lastly prevention or treatment of non-steroidal anti-inflammatory drugs induced ulcers. Now let's talk about the pharmacokinetics. These drugs are orally administered as capsules containing enteric-coated granules. They must be taken 30 to 60 minutes before breakfast. Esomeprazole, lansoprazole, and pantoprazole are also available in intravenous formulations. A single daily dose affects acid secretion for 2 to 3 days, partly because of the accumulation in the canaliculi and partly because it inhibits the proton pump irreversibly. Note that it takes about 80 hours for the enzyme to be resynthesized. Metabolites of these agents are excreted in urine and feces. Drug interaction. We have mentioned before that there are three types of stimuli to induce gastric secretion of hydrochloric acid. The first was parasympathetic innervation. The second was paracrine release of histamine. And the third was the paracrine release of the polypeptide gastrin from these cells. If you want to use the H2 receptor antagonist to prevent the histamine stimuli, we should not use it with the PPI simultaneously. We should take it well after the PPI. For example, we can take the PPI in the morning and the H2 receptor antagonist in the evening. The use of PPIs with the clopidogrel, which is an antithrombotic agent, is not recommended because of a possible increased risk of cardiovascular events. Cautions. Proton pump inhibitors should be used with caution in patients with liver disease or in women who are pregnant or breastfeeding. There are a highly important note that the use of these drugs may mask the symptoms of gastric cancer. The unwanted effects of these drugs are headache, diarrhea, nausea, fractures, and lastly, gastrointestinal disturbance. Now let's summarize what we have mentioned before. The PPIs prevent the secretion of gastric acid via inhibiting the proton pump. Never forget the mnemonic Doppler. The use of these drugs may mask the symptoms of gastric cancer. This is a very important point.